Now, let me ask the frequently asked questions that are in everybody's mind right now. And believe me, many of these questions are questions I'm asking as well, because I'm also wondering about, the year-end holiday, vacations, time spent with people, away from work. Is that actually going to happen, or is it not going to actually work out? Let me just tell you about some of those questions. Why do we need travel curbs? You're probably wondering, are there going to be any travel curbs? Well, they're being considered at this point of time because it is to curb the Omicron threat, which has now been detected in India. Has India banned flights from any country right now? The answer to that at this point of time is no, and there are many reasons for that. India believes that a blanket ban on flights is not the answer to containing Omicron. What should you do if you have already traveled abroad? Well, you need to upload your travel history and your RT-PCR report on the Health Suvidha portal immediately. Is an RT-PCR test needed before flying to India? If you're an inbound passenger from abroad, do you need it? Yes, you need a negative RT-PCR test report, which you will need to submit once you land here in India. How early can you get tested before actually traveling? A negative report is required within 72 hours of that flight you take. Is institutional quarantine going to be mandatory for people arriving here in India? People who've tested negative can isolate themselves at home, is what the rules are at this point of time. Are there rules for high-risk countries? Are those rules also the same? The rules are slightly different. RT-PCR test on arrival is mandatory. For how long do you need to isolate yourself? The answer to that is 7 days quarantine and then 7 days of monitoring which takes place. Now, what if someone tests positive after travel? Well, the person will then be sent to institutional quarantine, is what we're getting at this point of time. Now, at a time when the threat of this mutant COVID variant, Omicron, is looming large with 2 cases now detected here in India, the chorus within the country is growing for booster doses of vaccines. The Serum Institute of India has sought approval for a booster dose for its Covishield jab from the Drugs Controller General of India. The Serum Institute has cited the United Kingdom's regulatory booster approval for the AstraZeneca vaccine and has claimed that it has enough vaccine stock in the country. The COVID-19 task force's member, N.K. Arora, has said that India will have a policy on booster doses within the next 2 weeks. So far, 36 nations have been administering booster COVID doses to their populations. The US, leading the nations, has administered 1.24 crore booster doses, followed by Turkey with 1.19 crore booster doses.
If somebody has not been able to mount enough immunity after the 2 doses, for that individual or for a special subgroup, one could think of, administering a 3rd dose. But the discussion around that should be disjointed from the Omicron, because we do not know yet whether the presence of Omicron would require a vaccine, because we must remember that these vaccines against COVID-19, they are disease-modifying vaccines. They are not infection-preventing vaccines.
We know that the virus has infected people who have received 2 doses of vaccine. We even know from the Israeli case that there is a person who had received a booster dose of a Pfizer vaccine, therefore 3 doses of vaccine, and still got infected. So we need much more clinical information on the severity of illness, much more clinical information on when it infects a vaccinated person, what it does, how severe is the breakthrough infection, before we decide what else is needed.
Our reading as of now is that the boosters, given the situation of the vaccination program that we have today with our vaccines, is really not required at this point in time. We'll continue to explore the timing and the need for the boosters going along. There are studies that are in the offing. There are studies that are ongoing, in fact, and there is data that's very systematically being tracked